So many carepreneurs and entrepreneurs suffer from the idea that they need experience in healthcare, or they have to be registered with CQC to run a care agency, for example, or they have to have a business degree to run an online business, for example, or that they're going to need loads of money to pay for stock. Because that's what I was worried about. I thought, I haven't got money to pay for stock. I can't do this business. And I thought, hang on a minute, let me look at this drop shipping or buying items from someone at a cheaper price and then selling it on at a higher price, but getting them to deliver with your information on there. So they know it's coming from your channel, for example. But you know something, nothing can be further from the truth, because there's systems. So how can healthcare workers be business owners? Carepreneurs are individuals who specialize in providing a care service, also known as care providers. It's a mixture of care providers and entrepreneurs, hence the name, I call it carepreneurs. Carepreneurs leverage their experience as healthcare professionals using creative thinking, successful systems, investment in time and money, and planning. Being a carepreneur, you will have many roles in your company. You're wearing many hats. You already have the necessary skills to multitask because you've done this in your job, for example. You're multitasking all the time. You're wearing many hats. You may be doing different roles in that job as well. So healthcare professionals are already doing these tasks every day in their current role. They can include more cost-effective means of care delivery, more efficient patient treatment, and the ability to create more robust, individualized, proactive patient wellness strategies. Just drank my water there. Ultimately, carepreneurs can make it possible for patients to have better control over their health and healthcare costs, which could go a long way towards helping them improve their quality of life. Becoming a carepreneur can give you a better sense of freedom and better control, and freedom to build your healthcare business on your terms. This is earned by implementation, strategies, and processes. Care is not easy. I'm sure you'll all agree, to go into. It is not a get-rich-quick scheme either. You must be willing to put the hard work in, time and effort, but you already know this anyway. You need to be good enough. You know this already because you're doing it right now. And I'd like to introduce you to the 90-day immersion program, which I call the Done For You. There's also, this is also massive as well. It's explosion. That's all I can say. Okay, so if you want to get started in your healthcare tech business or online business with clients, then this is exactly what you're looking for. The healthcare technology refers to any IT tools or software designed to boost hospital administration, productivity, giving you insights into medicine treatments, or improve the overall quality of care provided. Today's healthcare industry is going to be, it's estimated at about 2 trillion. I don't even know how to do that in numbers. I don't know if any of you know how to do that in numbers. I haven't worked that one out yet. Well, I haven't needed to write down how much is a trillion, but you can imagine it's absolutely massive. And we've got the large organizations like the NHS formulated with the health and social care departments, government departments, to have this health tech going on, but they're also looking for providers to work with them. And this is huge. It's happening. I'm sure some of you must see this at where you're working. If you're working in a healthcare environment, you're seeing it already. However, you can be a part of that. So this is the 90-day immersion training. And I just want to talk to you about the types of healthcare and tech ecosystems, the e-health patient data multi-platforms. There's patient transportation, we all know that, but there's telecare, there's virtual care. If you are, for example, a nurse, you're a specialist, you can also be providing this, but you can get staff members that are qualified to be able to deliver this online. So there's multi-platforms here that you can be looking at. I mean, I've got 50, but there's actually over 100. There's obviously recruitment care agency. We all know that you can do this online as well. There's imaging diagnostics, healthcare mobile app development to do with healthcare tech, recruitment healthcare software, online pharmacy, healthcare digital marketing services, healthcare blogger, medical transcription services, medical records management, medical billing services, online healthcare community, online healthcare insurance agency, and there's robotics. There's patient advocate groups, there's e-privacy, that type of business as well, keeping people's information safe, working with the, GDPR, for example. There's digital healthcare, there's telemedicines. You can be a healthcare virtual assistant. You can also be a blockchain healthcare, and that is to do with different types of like information that you can provide. Chatbox services, for example, tech healthcare recruitment agency, wearables, 5Gs. That's, heart monitors and things like that you can put on your wrist, the watch, smart watches, for example. Travel healthcare company, virtual care company, virtual specialty care, specialist care, complex care, for example, virtual mental health services, prescription delivery, remote patient monitoring. And there's lots of funding out there. One organization, she got, I think it was about 500,000, and people are getting millions as well, funding to do these types of businesses. The government wants you to work with them because it's about them seeing that there's an issue with the staff shortages, etc., and we can still continue providing the services in the community and also in the hospitals and in the care homes, for example. But it is good for you as an organization to look at becoming a health tech organization, because you're meeting the future then. Don't wait till 10 years down the line. Start looking at this now and start doing it now, because you will achieve so much and you will get ahead of your competitors, because there's only a small percentage of individuals. I'm going to mute because it's distracted me. There's a small amount, a percentage of people doing this now. This is a video here, which I'm going to play to you. And like I said, there's health tech podcasts that you can do. If you're a specialist, you can talk about things. Patient transport, because although you're driving the vehicle, it's still connected with the healthcare tech. Now I'm just going to play this video so that you can hear. It's talking about digital healthcare. You'll get a copy of this as well.
What are the long-term trends that will shape the digital health market in 2021? This video will summarize some significant shifts to be expected following industry reports, interviews I made, and articles published in reputable health magazines. My name is Artur Olesch and I'm editor-in-chief of AboutDigitalHealth.com. So let's get started. COVID-19 is the first global pandemic in the digital age. Never waste a good crisis, said once Winston Churchill. Many healthcare technology developers seem to make the most of the sudden increase in demand for health innovations. This is a time when digital solution providers can prove the value of what they are doing. In 2021, we can expect further expansion of telemedicine. Patients, doctors, and decision makers have discovered that telecare is easy to implement and doesn't require costly investments in hardware or software. In some cases, it can supplement or even replace on-site visits. This is a part of a more significant trend. Healthcare becomes available where the patient is. According to Rock Health, on-demand healthcare services were the most funded value propositions in 2020. In one of the Forbes articles, we can read, as patients increasingly prefer virtual tools, digital self-enrollment capabilities, such as scheduling an appointment, providing healthcare insurance information, and receiving pre- and post-appointment communications online, will be in increasing demand. Additionally, remote monitoring technology for both active and passive healthcare consumers will likely gain traction over time. No matter if we call it telemedicine 2.0 or deep telemedicine, the existing standards must change. Otherwise, the lack of added value will push telecare into the trouble that electronic medical records are facing. The New Yorker described already 2 years ago why doctors hate their computers. Digitalization promises to make medical care easier and more efficient, but are screens coming between doctors and patients? This headline may also refer to telemedicine. Virtual reality will also gain importance. VR in healthcare is believed to work well in pain relief and treating certain mental diseases. The market will grow to $2.4 billion by 2026. If you want to explore the power of virtual medicine, I recommend the recently published book VRX, How Virtual Therapeutics Will Revolutionize Medicine. The author, Brennan Spiegel, Director of Health Services Research for Cedars-Sinai Health System, gives examples of many VR applications. This revolutionary new kind of care has no side effects and can be surprisingly effective. There is also a dynamic development of national or local health platforms providing patients with access to electronic health records, allowing them to manage their own health. These platforms help facilitate personalized prevention programs and the communication between the patient and healthcare settings or public health institutions. How it's important we've seen during the pandemic. Health platforms will also play a central role in population health. They can transform the system from chaotic care to continuous, holistic and coordinated care, improving patients' experience. Impressive progress is being made in artificial intelligence. According to the forecast, the AI-powered systems market in healthcare will exceed $34 billion by 2025. AI algorithms will be applied more often in the diagnostic systems, precision medicine, genomics, and the development of new drugs. Artificial intelligence will help people to lead a personalized lifestyle, predict diseases earlier, and live longer. It will accelerate medical research and speed up clinical studies. Following an article published in Nature in September 2020, there were 29 FDA-approved artificial intelligence and machine learning algorithms for applications in healthcare. More details you can find in the paper The State of Artificial Intelligence-Based, FDA-approved medical devices and algorithms, an online database published in Nature. Regarding international cooperation in digital health, Europe is at the forefront. European Commission wants to intensify the investments in the infrastructure for the cross-border exchange of health data. In February 2020, the Commission presented two strategic documents, a European data strategy and white paper on artificial intelligence, a European approach to excellence and trust. The so-called European health data space, one of the planned initiatives under the new data strategy, should promote better exchange and access to different health data types to support healthcare delivery, health research, and health policy-making purposes. With no surprise, the Internet of Medical Things will continue to grow. Healthcare present in every aspect of life is one of the trends suggested by Forbes magazine in the article The 5 Biggest Healthcare Trends in 2021 Everyone Should Be Ready for Today. The author claims that in 2020 every company has had to become.
So, as you can see, you'll be able to listen to that video, and hopefully you were able to get the gist of that video. So we're moving into this new, well, it's not a new era, it's something that's been in the pipeline for some time, and the pandemic has really pushed it forward to us even more with the virtual wards that have been happening, the appointments online. All of this has really pushed it forward.
A tech company, as data and computing have become essential to everything we do. In 2021, every company will learn to become a healthcare company too, as safeguarding employees and customers becomes a core requirement of doing businesses, we can read in the Forbes magazine. When doctors' offices stayed closed during the lockdown, many countries had made available symptom checkers to support patients worried about COVID-related symptoms. Since then, chatbots and AI-powered health services have got wind in the wings. They can reduce the number of unnecessary medical visits and the administrative burden on doctors. According to the latest Deloitte report, Digital Transformation Shaping the Future of European Healthcare, Europe is expected to be short of 4.1 million healthcare workers by 2030. Overworked staff face burnout. Around a third of European clinicians think of leaving their profession. The imbalance between supply and demand for medical services is growing, and digitalization can offer some support to make this gap smaller. And finally, 2020 has boosted digital therapeutics since a new law, Digital Healthcare Act, allows German doctors to prescribe mobile apps that successfully pass the application process. Digital health application developers get reimbursed by the German statutory health insurers. By the end of the year, already 9 apps were approved. Will other countries follow this digital-friendly law? And what do you think? What can we expect in 2021? Please leave your comment below this video.
So there's a lot happening now. We're being supercharged into this e-platform, this health tech platform, and there's no going back. We can't avoid it, but we need to get used to it now in order to get ahead of the game. And this is why I've created these programs, so that I can help you to achieve multiple income stream, whether you do on, because not everyone likes to do healthcare for whatever reason. Maybe you want to do the multiple streams of income, but there's the healthcare market is the e-tech, sorry, the healthcare tech is massive, it's huge, and they need more people to help. So the 90-day immersion program makes it simple for you to, number one, get 6-7 figure business, scalable, successfully online business, or you can do a healthcare tech business. Number two, you can learn how to get customers buying your items while you sleep. That's for the online multiple streams of income, bundle, or learn how to get contracts for your healthcare tech business. There's hardly any competition for this. You know, it is amazing what is happening. We can't avoid it. Healthcare tech models. You'll get to learn, number 3, you'll get to learn 50 healthcare tech models that you can implement in 90 days. You'll get in front, you'll be at the front before your competitors get wind of this, and you'll be able to dominate your market in your industry. We are all doing business online nowadays. Everything business has to be embraced online. You can run a healthcare business online from the comfort of your own home. Virtual world online, connected by computers, communicating with each other, whether it's by email, fax, or telephone, etc. We're online. We're doing it. So there are various types of niche businesses. And I'm going to explain, so I'm going to list some of them. I'm not going to go into detail because I want to explain that when we're doing the next web classes as well. So you could be doing patient transport, telecare, virtual care, recruitment care agency, which everyone seems to know already, imaging diagnostic, providing healthcare mobile app developments, recruitment healthcare software, online pharmacies, healthcare digital marketing services. You could be a healthcare blogger. You could be a medical transcription service. You could provide medical records management. You could provide medical billing services, online health community, online healthcare insurance agency, online medical consultancies, medical tourist operators. You could be a midwife or a doula, birth freely childbirth services. You could do massage therapy, wellness coach, healthcare training school, healthcare uniforms online, hospital cleaning business, accountancy business, occupational therapy, health information website, online health and wellness business, online health coach, medical equipment devices, residential nursing homes, medical equipment training school, mother and baby unit, ambulance service, PPE, dental practice agency, optical, physiotherapist agency, home care agency, nursing agency, children's services, social worker agency. There's about 50 businesses which you could set up. But find one that you feel that you're going to resonate with, and that will be your drive for making it a success. Find your passion first, and then money will follow. So find your passion and be your own boss. The above list on the previous slide is just the few that I have done and been interested in doing. You may have the skills which are transferable to a business. And I just want to give you our contact details here, which is 01903 898 135. Our website is here. All right, so thank you so much, everyone. Have a blessed day, and it's been wonderful. And I hope that I've opened your mind up. I hope that I've made you realize what you can achieve and that it is reachable. You know, reach for the stars because it's yours. You can have it. So thank you, everyone. Take care, and I'll speak with you soon. Bye.